Close your eyes for just a moment and imagine the most ordinary version of tonight. You pull back the covers, settle into the familiar weight of your pillow, let the tension of the day dissolve from your shoulders, and drift into what you fully expect to be a quiet and uneventful night of sleep, the same way you have done on countless evenings throughout your life. And then consider the possibility that for some people, that exact moment, that perfectly ordinary Tuesday or Wednesday night, becomes the last conscious experience they will ever have, not because of a dramatic medical emergency that announced itself with chest-clutching pain earlier in the day, not because of some rare genetic disorder that had been tracked and monitored for years, but because of a small handful of thoroughly unremarkable habits they had been repeating every single evening for decades without ever once suspecting that those habits were constructing, brick by quiet brick, the conditions for a fatal cardiovascular event during the very hours their body most desperately needed to recover. And I am sharing that not to flood you with unnecessary fear or manufacture a sense of crisis where none needs to exist, but because, as someone who has spent the better part of my professional life as a physician focused on cardiovascular health in adults over 50, I have watched this reality play out far too many times to stay silent about it. And the truth is that the medical literature is unambiguous on this point. Hundreds of thousands of heart attacks and strokes occur every single year while people are asleep, concentrated overwhelmingly in the hours between 1 and 6 in the morning, and the data from the American Heart Association makes clear that nearly half of all fatal cardiovascular events in older adults fall within that nocturnal window, which is not a statistical coincidence, but a direct reflection of what happens when normal sleep physiology collides night after night with specific behavioral patterns that quietly dismantle every protective mechanism the sleeping body is trying to activate on your behalf. And my name is Dr. Laura, and what I want to do in the next several minutes is walk you through exactly which 5 nighttime habits are most responsible for turning sleep from a period of healing into a period of danger, and then give you a concrete and immediately actionable routine you can begin following tonight, not after your next checkup, not when you finally get around to it, but this very evening, because the protective changes I am going to describe are not complicated. They do not require expensive interventions or dramatic lifestyle upheaval. And every single one of them is grounded in peer-reviewed research I will explain in plain and usable terms. So let us begin with the first and perhaps the most consistently underestimated of all 5 habits, which is eating late and eating heavily, because most people in this age group do not think of their dinner schedule as a cardiovascular decision. It is just what happens at the end of a long day, whenever there is finally time to sit down and eat. But after the age of 50, the timing and the composition of your evening meal can be the single most consequential variable, determining whether your heart rests through the night or labors under significant metabolic pressure for hours while you sleep. And here is why. When a large, fat-heavy, sodium-rich meal enters your digestive system late in the evening, particularly after 8 or 9 at night, your gastrointestinal tract immediately demands a massive redirection of blood supply to handle the digestion workload, which forces your heart to pump harder and at higher volume at precisely the moment it should be beginning to ease into its overnight rhythm, and your blood pressure, which under healthy circumstances would be drifting naturally downward as sleep approaches in that essential process physicians call nocturnal dipping, instead climbs upward under the cardiovascular burden of digestion, and your metabolism, which should be decelerating to support cellular repair and deep stage restoration, gets driven in the entirely wrong direction at the worst possible time. And a landmark study published in the European Heart Journal that followed more than 100,000 participants across multiple years found that individuals who regularly ate late dinners showed substantially elevated rates of nighttime heart attacks and strokes compared to those who consumed their evening meals earlier, because late-night digestion pushes triglyceride levels higher in the bloodstream, promotes chronic low-grade inflammation in the arterial walls, and disrupts the natural pressure drop that is one of the most powerful protective mechanisms your cardiovascular system has. And there is an additional risk almost nobody connects to heart health, which is that heavy evening eating dramatically raises the probability of acid reflux during sleep. And acid reflux is not merely an uncomfortable inconvenience, it can activate the vagus nerve and provoke serious disruptions to cardiac rhythm, a particular danger in adults over 50 whose electrical conduction pathways are already less resilient than in younger decades. And I treated a 68-year-old patient who had eaten heavy late dinners as a lifelong habit and whose heart, after years of quietly absorbing that nocturnal overwork, eventually gave way to a heart attack during sleep, and the change in her outcome after we restructured her evening eating patterns was immediate and measurable because earlier and lighter evening meals allow blood pressure to follow its natural downward arc, reduce inflammatory arterial stress, and restore the genuine overnight rest the cardiovascular system is entitled to have. Which brings me directly to the second deadly nighttime habit, one that affects millions of adults who believe they are already handling it responsibly, skipping prescribed medications or taking them at inconsistent times, and if you are currently on treatment for high blood pressure, elevated cholesterol, or blood clotting risk. What I am about to explain is not background information. It may be among the most critical things you hear today, because healthy blood pressure in a well-functioning cardiovascular system follows a natural circadian rhythm that produces a meaningful drop during sleep, but a very large proportion of adults over 50 do not experience that drop, and many of them actually see their pressure rise during the night in a condition known as nocturnal hypertension that carries extreme cardiovascular risk while producing absolutely no symptoms the individual can perceive or feel. And research published in the Lancet demonstrated that medications taken on the correct schedule and at the correct time can reduce the probability of nighttime heart attacks and strokes by nearly half, while missed doses or erratic timing create windows during which pressure can surge silently, destabilize fragile arterial plaques, and set clots in motion toward the heart or brain with no warning of any kind. And I have personally treated patients who were skipping their evening medications several times a week, each time telling themselves it would not matter this once, accumulating a cardiovascular debt they could not see. And one of those patients suffered a severe nocturnal stroke that left him permanently paralyzed on one side, a tragedy that was not inevitable, but the direct result of an assumption that close enough was good enough. And the message I want you to take from that is not guilt, but precision. The timing of every dose deserves a specific and direct conversation with your doctor rather than an improvised approximation, because your life may genuinely depend on that level of consistency. And the third deadly nighttime habit is simultaneously one of the most dangerous and one of the most widely undiagnosed cardiovascular threats in adults over 50. And that is sleep apnea that has never been identified or is not being properly treated, because sleep apnea produces repeated interruptions in breathing throughout the night, pauses that can last 10, 20, or even 30 seconds at a stretch. And with every single one of those pauses, oxygen levels in the blood fall, and each drop registers in the body as a physiological emergency that triggers an immediate response. The heart rate accelerates, blood pressure surges, and a cascade of stress hormones floods the system in an attempt to force a return to normal breathing. And this cycle can repeat itself literally hundreds of times across a single night, and the person wakes in the morning with no conscious recollection of any of it, which is precisely why the condition persists undetected for so long and why its cumulative cardiovascular toll is so severe. And research from leading academic medical institutions has established that untreated sleep apnea triples the risk of a nocturnal heart attack and increases stroke risk by a factor of 4. And the warning signs to watch for include chronic loud snoring, waking with a gasping or choking sensation, morning headaches, blood pressure readings that fail to respond appropriately to medication, and a level of daytime fatigue that no amount of sleep seems to resolve. And I treated a woman whose snoring had been dismissed for years as a minor annoyance until one night when her oxygen saturation dropped far enough to destabilize her cardiac rhythm, she survived because help arrived quickly. And the treatment she received afterward transformed her energy levels, her blood pressure control, and her overall quality of life in ways she had not imagined possible. And while sleeping on your side provides some marginal benefit in mild cases, it cannot replace a proper clinical evaluation if these symptoms are part of your life. And I urge you not to postpone that conversation, because the fourth deadly nighttime habit is one that many older adults adopt with entirely good intentions, believing it is sensible and responsible self-care. Going to bed in a state of inadequate hydration, often deliberately, because the thirst reflex weakens with age and many people consciously restrict evening fluids to avoid having to get up during the night, which seems like reasonable logic on the surface and conceals a genuine physiological danger beneath it, because your body continues losing water throughout the night, through every breath you exhale, and through perspiration. So if you begin the night already underhydrated, your circulatory system starts its most vulnerable period of the 24-hour cycle already under strain, and when the blood becomes more concentrated due to that fluid deficit, it thickens and slows, and that slower and denser blood is substantially more prone to forming the kind of clots that cause strokes and heart attacks. And when you layer that risk on top of the natural overnight slowing of the heart rate and the drop in blood pressure, the physiological conditions for a serious cardiovascular event during the early morning hours become alarmingly favorable. And research published in the Journal of Cardiovascular Disease found that even mild dehydration elevated the risk of nocturnal cardiovascular events by more than 60%. And I remember vividly a 70-year-old patient of mine who told me almost with pride that he had not drunk water after dinner in more years than he could count, viewing it as a form of healthy personal discipline. And not long after that conversation, he suffered a stroke during sleep imaging, showed a clot in a cerebral artery, and his blood concentration levels confirmed what I had feared. And the practical correction here requires no great sacrifice. Drink a full glass of water 1 to 2 hours before bed, empty your bladder completely before lying down, and keep a small amount of water within reach on your nightstand so that if you wake in the night with a dry mouth or throat, you can address it without getting up, and none of that disrupts your sleep in any meaningful way while providing real and measurable protection to your heart and brain during the hours when they are most exposed to risk. And the fifth and final deadly nighttime habit is the one that produces the most surprise when I raise it in clinical conversations, because almost no one has ever been told that the temperature of their bedroom is a meaningful cardiovascular variable, sleeping in a room that is either too warm or too cold. And I want to be precise about why this matters, because it is not a matter of comfort preference. It is a direct physiological factor in how your cardiovascular system functions during sleep, with measurable effects on heart rate, vascular resistance, and the quality of the deep restorative sleep stages your body needs to carry out its most important overnight repair processes. And when the sleeping environment is too warm, your body is forced to work continuously to shed excess heat by dilating blood vessels near the skin surface, accelerating heart rate, and losing fluid through sweat, all of which pushes blood pressure upward at the exact time it needs to be moving downward. And research from Harvard has linked bedroom temperatures above 24 degrees Celsius to significantly elevated nocturnal cardiovascular risk, while cold sleeping environments create the inverse problem, because when the body is exposed to cold, blood vessels constrict to retain heat, and that constriction raises the vascular resistance your heart must pump against. And in adults over 50 whose arterial walls have already lost some of their youthful flexibility, that additional mechanical burden can become the physiological tipping point that triggers a cardiac event or a stroke, which is why European medical data consistently shows spikes in nighttime cardiac mortality during cold weather periods concentrated heavily among older adults. And the temperature range that best supports cardiovascular stability during sleep falls between 18 and 22 degrees Celsius, roughly 65 to 70 degrees Fahrenheit, within which heart rate remains steady, blood pressure behaves as it should, and the body moves through the deeper sleep stages responsible for genuine overnight recovery, rather than spending those hours in a thermally stressed state that keeps the cardiovascular system perpetually on alert. And now that all 5 habits are clearly on the table, along with the specific mechanisms through which each one creates risk, I want to give you the other half of this conversation, which is a simple and structured evening routine you can begin tonight that is built entirely around protecting your heart and brain during sleep, starting around 7 in the evening with a light dinner centered on lean protein, vegetables, and easily digestible carbohydrates, with modest portions and a conscious effort to avoid the heavy fats, excessive sodium, and dense refined carbohydrates that force your digestive system into prolonged overnight labor, followed shortly after the meal by a glass of water, and, if evening medications are prescribed, taking them at precisely the indicated time without substitution or delay, and then around 8 settling into genuinely calming activities, a slow walk, relaxed reading, quiet music while moving deliberately away from emotionally activating content, confrontational conversations, and bright screens that suppress melatonin production and keep the nervous system in a state of alertness it should be leaving behind. And by 9, beginning to actively prepare the sleep environment by setting the room temperature within the correct range, placing water on the nightstand, and bringing the lighting down low enough to signal to the brain that the day is ending, and at 9:30 completing a full pre-sleep hygiene routine, including emptying the bladder entirely, brushing teeth, and taking any remaining scheduled medications. And by 10 settling into the sleeping position that best supports your health side, sleeping with adequate neck support if snoring or suspected sleep apnea is part of your picture, since lying on your back significantly worsens airway obstruction during sleep, and if you wake during the night, sitting up before standing, moving slowly to prevent a sudden pressure drop, and taking small sips of water if needed, rather than rising abruptly and creating unnecessary cardiovascular stress, and multiple studies examining circadian blood pressure rhythms and sleep safety have found that this kind of intentional structured routine reduces nocturnal cardiovascular stress by more than 40%, not through anything expensive or extreme, but through the consistent application of protective choices that compound meaningfully in their benefit over weeks and months, and to bring everything into one clear and final picture. The 5 habits that are quietly responsible for an enormous proportion of the heart attacks and strokes that occur during sleep are late and heavy evening meals, missed or mistimed medications, unidentified or untreated sleep apnea, going to bed inadequately hydrated, and sleeping in a thermally unregulated environment, and any one of them carries real and independent risk. And in combination, they create conditions for nocturnal cardiovascular events that are not random or unavoidable, but entirely the product of identifiable daily behaviors that can be recognized, understood, and changed starting tonight. And I want you to hold on to that not as a reason for anxiety, but as a source of genuine agency over your own health. Because the overwhelming majority of these events do not have to happen. They are not sealed into your future by fate or genetics. They are the predictable outcome of patterns that are within your power to change without waiting for a crisis to force your hand, and your heart has been working every second of every day for decades without pause, without complaint, and without asking for anything except the conditions it needs to genuinely recover. During the hours when you rest, give it those conditions starting tonight. And I am Dr. Laura, and I will see you in the next video.